All right, folks. Well, good morning and good afternoon, depending on what coast you're on. We're so excited to have you with us today talking about how to navigate mental health startups as a therapist, which is definitely sort of a 10,000-foot description of what we're going to be talking about today. But we have an incredible guest speaker joining us, Michael Fulwiler. He is director of brand at Herd, founder of Fulwiler Media, and creator of Therapy Marketer. And it's very exciting to get him for a full hour today where we can ask him questions in real time. With that, I see those numbers climbing. So let's get into the meat of today. Let's get to that next slide there. All right, our agenda. So first, we're going to meet Michael, give you a quick overview of who he is. And just in case you want to know who I am, so I'm not just an anonymous woman talking at you today, my name is Carrie Scott. I work at Spruce Health. I facilitate these webinars on a monthly basis, and I always have fun guest speakers, Michael being my favorite to date. So please do remember to
Wow.
tune in and join us. Yeah, that's a big one. I know. We'll get into what is Spruce if you're new to us. And then we're going to get into understanding, again, how to navigate mental health startups and really what does that mean, mental health startups? Let's talk about that. Why these new tech companies have emerged. Importantly, how client data is handled. And we're going to get into HIPAA compliance, how information is collected, and what happens to that information. We're also going to talk about the importance of enlisting a clinician, either on the founding team or the leadership team of these companies. And I guess what you guys want to know, as I would too, is the comp structure. How are therapists paid? How do they figure that out? And what does it mean to you? And then questions. So if you have a question that's relevant to the slide we're on, please drop it into the Q&A. We've disabled chat, so the Q&A is the place where you're going to want to put any questions or comments that you have, and we'll take them as we go, again, if they're relevant. If not, we'll save them up for the end and address them there, because we will leave time at the end for questions. Quick housekeeping. This will be recorded. In fact, it's recording right now. So if you have to drop off or you feel like you've missed something, don't worry. I will give you access to the recording later today. It will also live on the Spruce blog, so you can always jump back in and take a look at anything you may have missed. With that, let's jump to the next slide. And intro, I feel like I just did that. We're going to just, again, kind of round up like how the heck this industry got so big so fast and what it means for you. And now let's do the rundown on who Michael is. So Michael has more than a decade of professional experience in mental health. He is not a therapist, but he knows a whole lot about it. Prior to joining Herd as director of brand, he founded Fulwiler Media, and he's consulted with 20 plus mental health tech companies. He was also the chief marketing officer of the Gottman Institute and the creator of Therapy Marketer, along with being an advisor for multiple mental health startups, including Therapy for Black Girls and Ours. I know that that's just a very high level. Michael, I'll let you jump in and add any color to that if I've missed something essential.
No, you've said it.
Brilliant. All right. I love that. Terrific. Well, he's just being humble because this man is pretty impressive, and we'll hear more from him in a sec. But just really quickly, we'll show you a quick slide on Spruce for those of you new to us today. So what's Spruce in a nutshell? It's a healthcare communication platform, and it's designed for medical professionals like yourselves. And it's been designed for easy HIPAA compliance. It consolidates all the channels. So whether it's phone, fax, text, video, AKA telemedicine, it's in one unified cloud-based solution. And a lot of folks like to call it their office in their pocket, which I think is kind of cool. It's simply the simplest way to get in touch with your provider and for providers to connect with patients. And I think that's why we have such a strong following among mental health professionals. So with that, we're going to get into the heart of what we're talking about today. I'm going to turn my video off, but I will stay right here and we'll be facilitating the Q&A throughout. So thank you so much for joining us, Michael. I'm excited to hear about your talk today.
Thank you, Carrie, for inviting me back. It's great to be here. You know, we were chatting about a topic for this presentation, and one of the questions that I get from therapists all the time is, hey, I was contacted by X mental health startup. What do you know about them? Are they legit? Would you, recommend working with them? What have you heard? Right. So there's this big sort of challenge as therapists in navigating this system of, mental health companies that has really emerged in the last 4 to 5 years. So I want to start with this idea that mental health startups aren't good or bad, but they're here to stay. They're not going anywhere. I've talked to some therapists who've said, you know, mental health startups are, tech and venture capitalists need to, stay out of the mental health field, which I personally disagree. I think, there were therapists probably 10 years ago who said, therapy should never be done online, right? And as the field has evolved and as technology has improved, I think tech can really be a way to build a more efficient private practice. Technology can help you to save time. As a therapist, I think technology can also help you to reach more people. So personally, I believe that technology is inherently good. And I think mental health startups are, inherently good for the field. With that said, there are companies out there who have, developed somewhat of a reputation for the way that they've navigated ethics and compliance and, some decisions that they've made. And we're all familiar with those companies and we've seen the headlines, right? And we've seen them in the Facebook group. So I also want to say that I'm not here today to talk down or trash any company in this space. I'm hoping to present an objective view, an unbiased view to the best of my ability, with the full disclosure that I work for Herd, which is not technically a mental health startup, but we are an accounting software startup that works with therapists in private practice. So we do work in this field, although we're not delivering mental health care services directly. So, my goal is by the end of this session today, you'll have a better understanding of just how to navigate this landscape so you can feel more empowered to make your own decisions about whether or not to align with these companies or to leverage some of these companies in your business. So with that said, I think I want to start by sharing some really practical um, ideas of how do you first navigate this system of mental health startups. And the first is building something that I like to call a personal advisory board. So most startups have an advisory board. These are people who have expertise in various areas, and you can build one for yourself. You don't need to be a startup to have an advisory board. So think about who are 4 or 5 people, in your network that you really respect, and think about building a personal advisory board. So, you have those folks that you can consult with as, these things come up. Also ask other therapists. This seems like a no-brainer, but that's where I would also encourage you to go as well. Ask your colleagues, post in Facebook groups. Hey, have you heard about this company? Have you worked with this company? What has your experience been like? How do they treat therapists? Do they pay therapists well? Often compensation, which we'll get into later, isn't something that is necessarily public information, but you might be able to find out from folks who have worked for some of these companies. Then also, do your own due diligence. Read online reviews. Reddit is a great place to, do some research about some of these companies. There's Reddit threads about most companies, including Herd. So I'm on the brand side, right, of this. So I get to see a lot of these reviews. And, sometimes when we don't deliver on the promises that we make, and folks leave reviews or share their experience online, that can be really tough for for me to read. But at the same time, like if we don't hear that feedback, then we can't improve our product and service offering, right? So, we really appreciate the feedback that therapists provide to us. So, this is just a starting point. If like you take anything away from this conversation, I think it's really like seek out the help of others, right? Don't go like blindly into, working with one of these companies before doing your due diligence, and we'll talk about why. I think to take a step back, in order to understand how to navigate mental health startups, we need to understand like what a mental health startup is. And these are two what are called market maps of the mental health tech industry. The one on the left here was created by What If Ventures, which is a venture capital firm that specializes in investing in mental health companies. They've since expanded and now invest in other healthcare companies. But you can see there's some primary categories here of mental health tech companies. I think when we think of mental health startups, we probably think of like therapy apps, right? Or therapy platforms. But there's actually quite a bit more to the ecosystem of mental health startups. So, some of the categories include digital therapeutics, which are virtual software interventions, measurement and testing, so measurement-based care platforms. There's a ton of mental health apps. I read a statistic somewhere like 10,000 mental health apps exist today on the App Store. What If Ventures, this was 2020, so this is 4 years ago, um, counted up all of the mental health startups and it was over 1,000, right? So a tremendous amount of companies, which makes it difficult to know like who's good and who's not. Telehealth is a big one, obviously, and that's only grown since the pandemic. There's also a group of peer-to-peer solutions, as well as B2B, so business to business. These are tools like Spruce or like Herd that work with mental health providers, more focused on their business, powering their back office. And then on the right side here, you have employer telehealth is another big one. So, you've probably heard of Lyra, Spring Health, Ginger, Modern Health. These are tech companies who partner with employers to provide therapy to employees. So, as a therapist, you contract through their EAP programs. There's also mental health hardware, wearables that are being developed. And we'll talk a little bit about kind of where technology is going. So I think just as like a takeaway here, there are many different types of companies. It's not just companies who are doing therapy online. I want to stop here to see if there's any questions.
Yeah, thank you. We had one person write in and say, please leave time to discuss the comp structure, which I know we will.
Totally.
We also had someone ask, and it may be premature and you may be tackling this later, but where do you see the future of mental health tech companies and the roles available for therapists in those spaces, whether it's C-suite positions, content creators, writers, subject matter experts, especially during what feels like an upcoming recession?
100%. Yeah, I'm going to talk about my predictions at the
Yeah.
end, so stick around for that. But I
Okay.
will plug Therapists in Tech, which is a great resource community nonprofit that supports therapists in tech. They have a Slack channel, and so I would definitely look them up if you're interested in working in tech as a therapist.
Perfect. Thank you for that, Michael. And everyone, please feel free to drop your questions in as you think of them, because we'll answer as we go and save time at the end.
So how do we get here? Like, how did we get to having over 1,000 mental health startups and 10,000 mental health apps? In economics, there's a premise of industry tailwinds, right? And so, or industry tailwinds. So we think about when you are flying in an airplane, if there are strong headwinds, that's wind that you're flying into, it slows the plane down and you might arrive at your destination late, right? But if there's really strong tailwinds, that's wind that is pushing your airplane forward, you may arrive at your destination early, right? So in economics, an industry tailwind is a factor that propels the industry forward. And there was really a perfect storm of three industry tailwinds that all happened simultaneously. The first was just a global decline of mental health, which, as mental health professionals, you're all aware of. Nearly a third of US adults had symptoms of depression and anxiety or anxiety in December of 2021, which is 3 times the amount in 2019, right? So just a massive decline of mental health during the pandemic, which also led to an increase in demand for therapy. At the same time, culturally, people started talking more openly about mental health. Therapy became less stigmatized and more normalized. So mental health is down, demand is up, right? And then also, really overnight, there was new adoption of technology. So therapists who were previously low tech, seeing clients in person, taking paper records, right? Like weren't really tech enabled in their business. Now were forced to adopt technology. So there was also demand from providers. And so from a business perspective, right, this is an incredible opportunity. This is when companies are built. And so from the outside, for investors, it's really like the perfect storm, right? And so these are the factors that really led to the increase in investment in the mental health space. This chart here is from A16Z, Andreessen Horowitz, which is a venture capital firm. I believe it's actually from last year, so 2023. This is showing categories, and they're like by growth. And this is marketplace category, excuse me. So a marketplace business is one that connects buyers and sellers. So you think about eBay, Amazon, right? These are marketplace businesses. Mental health, not even healthcare, mental health was by far the fastest growing marketplace category of all industries, right? And so maybe not surprising because you're seeing all of these marketplace companies pop up, right? Think of the Almas and the Headways and the EAP companies that we talked about, all of the therapist directories and matching platforms, right? Because people are looking for therapists. There's such a high demand for therapy that mental health is actually the fastest growing marketplace category of any industry. So the result of all of this I mentioned is an incredible amount of funding into mental health from venture capital firms. So if we look at pre-pandemic in 2019, there was $1 billion, this is billion with a B, invested in mental health. In 2020, that number increased to 2.7. So almost more than doubled, almost 3x. And then in 2021, that number jumped again to almost 5 billion. So we went from, in 2019, $1 billion of venture funding into these mental health companies to, within 3 years, almost 5 billion, which is an incredible amount. You can see here, if you look at on the right, this is by clinical indication. Mental health by far is the biggest category here. It did come back down. It's a question about pending recession. So I'll talk about this in a minute. But what we are seeing is funding has slowed a bit. So there was this boom during COVID and immediately following, and we are seeing a correction in the industry. But that's a lot of money that came into this field like very quickly. So before I get into data and privacy, is there any questions around um, funding and anything else there that I've covered?
It doesn't look like we have any questions about funding. I think people are probably more keen to learn about their own comp structure,
Sure.
because we're
Yeah.
all,
Great.
very
So
money minded.
awesome. Yep.
So I'll let you keep going, but oh wait, let me just see if this came in. Well, this one's a little off topic, but I'll save it. We'll save it. We'll answer it live
Yeah.
later.
Sarah, that's a great question. I'm going to come back to that at the end. I'm glad that
Yeah,
you asked it.
I like it.
So a big concern, right, in any technology company is always going to be data, right? And data privacy. We've seen it in social media with Facebook and what they're doing, right? With their Facebook ads, huge, like, investigations there at the congressional level. So I think a very important factor when navigating mental health startups as a therapist is really to understand how these companies are handling client data, right? If these companies are collecting PHI, are they HIPAA compliant? If they're not, to me, that feels like a non-starter, right? Like we don't want to be putting ourselves as clinicians and our license at risk. We don't want to be putting our clients' information at risk. So something that I would certainly ask if you're, leveraging one of these companies to offer therapy online or they are collecting PHI, like, are they HIPAA compliant? And that to me feels like a baseline. If they are HIPAA compliant, then they should offer you a BAA, which is a business associate agreement. Now, what are they doing with that client data? Um, as you are considering whether or not to work for one of these companies, um, these are questions that you should be asking and they should have an answer to, right? If they give you a generic, well, our data is encrypted. Okay, what does that mean? Um, what are you doing with the data? Are you selling it? Do you have like what is your policy around all of this? Like it should all be in writing, and that's something that you can review. And then a big question too I would ask is if I ever leave this service, what happens to my data? What happens to my client's data? Is it deleted? Um, like where does it go? How long do you keep it? Those types of things. Some companies may need to keep records, for example, but um, I think aligning with companies who take this very seriously is very important. I think if companies aren't taking this seriously, then to me, that is a red flag. And as a clinician, you have great intuition, right? That's like part of the work that you do as a therapist. And I would definitely trust your intuition. If something doesn't feel right, then it's probably not right. Questions here around EHRs. So, the most popular EHR that I see most therapists use, historically has been Simple Practice. I think they've done a great job with their, data privacy. Some other options include Therapy Notes. Jane is one that I've seen. They started in Canada, but they've expanded into the US. And I would say too, just as a general recommendation, as you're like evaluating these different companies, right? Set up a few meetings and like speak to them, ask questions, really like make sure that you get information and that you're informed before making a decision. Question here around retaining records. Um, Yeah, so that's another option too, is like, if you don't want to store your records on the cloud, or if EHRs are saying they won't retain records, you can download them yourself. My recommendation there would probably be to download those on a local, like hard drive, right? That's not connected to the internet, something that is secure. With that said, full disclosure, I'm not a data privacy expert, so I would consult a professional there. Cool. I do believe if you are using Google Workspace like Gmail, you can upgrade and pay for like a HIPAA compliant version. They sign a BAA with you. Great. This is another big thing that I would look out for as you're, navigating the space is whether or not there is a clinician on at least the founding team or leadership team. So do they have a clinical co-founder, or is there a chief clinical officer or chief medical officer? Early on, when a lot of these mental health startups were forming, I didn't see a lot of that. It seemed to be more technical folks or product folks, so people who were not coming from mental health. Um, and those were some of the companies who were running into ethical or legal issues later on. So I think as a therapist, if you're evaluating these companies, I would definitely look for that. I think that to me is super important because, like, especially if they're delivering mental health services, there needs to be a mental health professional in the room when they're making those decisions or they're building out, their product. And if there's not, there's an opportunity for you as a mental health professional to pitch yourself as either an advisor or a consultant to work with them. So there's an opportunity here, not just to work for these companies or use these services as a customer, but also to consult and advise these companies. This is something that I would ask, right? Like in a phone call or, as you're evaluating the business, do you have a clinician on your leadership team? How do you make clinical decisions? So this is probably why most of you are here, thinking about how therapists are paid, what a compensation structures look like. I think the big thing here to understand is the difference between 1099 and W-2 roles. So probably familiar, 1099 is an independent contractor where you are paid and you are responsible for paying taxes on your income. Taxes aren't withheld. Versus W-2 is like you're a W-2 employee of the company. Depending on where you live, the state that you're in, there are labor laws around, who can be considered a contractor versus employee. It's the same thing, right? And working with a group practice, more and more therapists now are working as W-2 employees versus 1099 contractors. But there are also a lot of therapists who are contracting with these mental health startups to supplement their income. So whether they're working at an agency or group practice and seeing clients on the side, or they're starting their private practice and they're leveraging, these startups to help build their caseload. Typically, those clinicians are being paid as 1099 contractors. If you work with a company to help with your insurance credentialing and insurance billing through companies like Headway, Alma, Grow Therapy, Rula, like these companies help providers to get credentialed, and they manage all their insurance billing under their MPI, and they pay therapists out as independent contractors. Mental health startups over the last few years have developed a reputation of underpaying therapists as low as $30 per session. I'm sure you've heard the stories. And also having some questionable compensation structures. I've seen and heard about companies who incentivize therapists for client retention, meaning Like the longer that a client stays on the platform paying for the service, the therapist is compensated or receives a bonus for retention, which, you know, ethically creates a conflict of interest, right? I've also seen with some text-based therapy apps that there are certain rules for therapists where messaging can't be imbalanced, meaning if a client sends a message that's a certain number of characters, you can't respond with more or less characters. The same thing if they respond with a longer message, like you have to sort of match the length of their message, which to me again just creates a conflict of interest. And so I think all of this again is something that you should ask for upfront. I'm going to share an example of an actual mental health company and their compensation structure. I'm not going to disclose what the company is, but just to give you an example of what that looks like, I will say that it's important to make sure that this compensation aligns with your values. Don't sell yourself short. As a therapist, like your work is incredibly valuable and you deserve to be paid your worth. And so don't allow these companies to underpay you, right? Like you have the choice to work with them or not. You are also in a position of leverage.
Michael,
Yep.
I'm wondering, I have a couple of questions if you don't mind taking them now, specific to this slide. With respect to, I mean, at first blush, this $30 per session seems terrible to me. And I work in marketing, but I've walked dogs for more than that. So I'm wondering, I mean, this feels very much like the gig economy. I mean, oh, the
Yep.
longer you stay, the more you get. It's almost the Uber model. Um, are they able to get away with this because people are accepting it? I mean, if everyone said no way, would that change anything? And is there any way to negotiate these rates as a therapist?
Yeah. So I think as a therapist, it can be easy to see this as, you know what, I could see a few clients in the evenings or the weekends, similar to, driving for Uber, right, or for Lyft, and just making some extra money on the side. But to me, it's very different, right? Like, there's nothing wrong with working in the gig economy, driving for Uber, making money, whether that's your full time or part time, you know, job. I think that that's great. I think that inherently, the opportunity for folks to make extra money by driving their car through an app is a net good thing, right? Um, for therapists, however, I think it's different. I think the application of the gig economy to mental health, I don't believe is a net positive thing. I mentioned earlier, mental health startups are neither good or bad. I actually think when it comes to the gig economy, my position on that is that it actually is a net negative to the field, just because as therapists, you have advanced training and education, right? And probably have student loans to pay off. And really, like, your time is very valuable and your expertise is very valuable. So I think, yes, like as long as therapists are continuing to accept these low rates, they will continue to happen. So I think in terms of negotiation, the rates are probably what they are. Um, and so I think, like, in order to move away from this and start to get paid what therapists are worth, I think we need to not accept this amount of low pay.
Yeah, for sure. And just one follow-up question. Given this comp model, I imagine it must also skew the landscape at large. So if people are able to get therapy for $30 a session, then why would anyone go to a private practice where the rates are going to be more like 150 and up?
Exactly. Yeah. I think you could make the argument that it actually cheapens the profession. It lessens the perceived value of therapy. You know, as a client, if I can get this service, to your point, for cheap, why would I go and pay more somewhere else? Right.
Right, right. And then last question, and I'll let you keep going. Do you think that there's ever been a perception from the client side that, okay, well, $30, if I'm paying $30, maybe it's not as good, but it's better than nothing?
Potentially, I think what we've seen too is, a lot of the providers that, and that's not to say all, but many of the providers who are, working for these companies tend to be folks who are earlier in their careers. Maybe they're new to the field, right? So they tend to have less experience. And so that's like part of it as well. I mean, you can just go on Reddit and read stories about these companies and, on both sides. Like there's also just a lot of like bad therapy that happens on these platforms.
Yeah, yeah, thank you. Let me just see if the question. Yeah, so Joe just asked something similar to what I was saying is how
Yeah.
does this impact the economic viability of private practice? And I think, you just spoke to that a little bit, but I'm thinking unless you can migrate your clients from these platforms over to your private practice and then somehow convince them that you're worth 3 or 4 or 5 times that rate, I mean, I'll let you speak to it, but it seems like a pretty big gap to bridge.
Yeah. I think that like people are starting to realize that the therapy that's delivered through these apps is not necessarily high quality. And there are a lot of issues and you know, there are problems with the model. And so I think people are starting to realize that. I'm starting to see more of that conversation. The challenge is, we go back to billions of dollars invested into these mental health companies. A lot of that money is going towards advertising. So I'm sure you've heard the podcast ads and you've seen all the TV commercials for these companies, right? Like that's where a lot of that money is going. And, the general public, for the most part, doesn't know the difference, right, between high quality and low quality therapy or what that means, or, that by paying less for therapy, it's, underpaying therapists. So I think there's also education that needs to continue to happen as well.
Thanks, Michael.
Mhm. So largely compensation structures for these companies are not disclosed publicly. Therapists who sign up to use these companies will sign an NDA, or there's some non-disclosure where they're not supposed to talk about what they make. And so a lot of like the conversations around compensation structures sort of happen, in private or in the Facebook groups. And this is something that this was shared with me by a therapist. This was a few years ago, but this is just an example of what, compensation structure looks like at one of these companies, whether it's changed or not. I'm not sure, but I think like this is pretty typical and just hopefully it gives you like a benchmark, right, of like what these companies are actually paying therapists. So this works on kind of a tiered system. So like the first 5 hours, you're paid $30 an hour, right? Which is pretty low. And then after that, 5 to 10 hours, you're paid $35 an hour, but only for those hours. So it's not like if you work more than 5 hours a week, you earn $35 an hour. Um, and it goes up every 5 hours by $5. So by the time you get to 35 hours a week, you're making $70 an hour, but it's still low, but it's better than $30 an hour. The issue with this that I have is that it incentivizes therapists to work more hours, right? Well, I need to work at least 35 hours a week to hit that $70 an hour. But then after that, I make $70 an hour. So now I'm working 40, 50, 60, 70 hours a week. And these companies too will advertise, you can make $100,000 a year. But when you look at it, it's like, well, that's it, 40, 45 hours a week, which as therapists, like a full-time caseload is really like 20 to 25 clinical hours a week, right? So it's also just like a quick path to burnout with how these comps are structured.
Thanks, Michael. We did get in some new questions, but they aren't necessarily aligned with comp. Do you want to save them for later, or do you want me to ask a few of them? A couple of them are comp related.
Yeah, we can. Let's take some of the
Into it.
compensation
Okay.
related questions.
So the first one is saying my employer bills insurance at a higher rate, but the split between therapists and the rest of the company tends to be 50%. There's no disclosure about where that money goes. Does it go to the front desk appointment makers, the billing department, the admin, marketing? Where does it go?
Yep. Yeah, this is pretty typical. Most group practices operate on some sort of fee split, whether it's 50-50, 60-40. The money that the group practice keeps goes towards all of the operational costs. It's very expensive to run a business, right? Especially if you're paying for rent, paying for marketing, paying for software subscriptions, all of the business licenses, right? Like all of that. And also the business needs to make money, right? For the owner. So that's where that percentage is going. So the benefit of working in a group practice, right, is that you don't have to worry about those things. You don't like, there's folks who are just like, I just want to be a therapist. I don't want to have to worry about the business side of things. But the trade-off is, you're splitting your income, right? Whereas if you were to go out on your own, you'd make 100% of that income, but you'd also have more expenses. So, if you're wondering about the split and if it's worth it or not, I would just do the math and try to figure out like if I went out on my own, how much more could I make? But also like how much more time am I going to spend doing those things that I'm not doing right now?
Yeah, yeah, for sure. There's another question, and I don't know if you're equipped to answer this one, but do you think that there are any opportunities to get equity as a clinician to join the clinical team of a mental health startup?
Definitely. I would say, the earlier stage, the company, the more likely that they are to compensate you with equity, like a percentage of equity in the business, because, they probably don't have a lot of money at that point to pay, right? Because like startups, it's a startup, right? And so typically a startup will go out and get some seed funding. Maybe they'll raise some money from friends and family. And so at that point, they may bring on an advisor, look for an advisor to just sort of help them to build out the idea of their product. And so at that point, they may not be able to pay someone. And so they'll offer them, hey, we'll give you, 2% equity in our company if you come on as an advisor, and just going in, recognizing I forget the exact statistic, like 95% of startups fail, right? So, most startups will fail. That equity becomes worth nothing, if the company goes out of business. However, there's an upside, right? Like if the company is to be successful and they're either acquired or they go public, then your equity in that business could become a nice payout. So
Yeah,
if you are going to receive equity, I would think about it in like a 5 to 7 year, window of like whether you're gonna get paid back for it.
for sure. Now, I'm guessing there probably aren't very many of those positions available. So to get one of those, it would be a pretty plum role. And I would imagine that maybe you have to be an influencer or someone with a fairly large following or a standout in some way to be selected. But how would someone actually get that gig? Would they just have to hustle hard?
I think it all comes down to relationship building. And, you know, when I was consulting with mental health companies in a more full-time capacity, something I would do is I would just watch the market and watch which companies were being funded, because whenever a company raises a round of funding, typically they'll put out an announcement. It'll be covered in the media, the industry media at least. Um, and so those are the companies that, I would reach out to and, let them know about what I did. And, I work as a marketing consultant specifically with mental health companies, if they needed help with marketing. And so as a therapist, just kind of keeping an eye on the industry. And um, these days, like it's not, as lucrative as it was in terms of the money coming in, but there's still companies that are, raising money and being funded. And one thing I would do is just keep an eye out. And, when you see an announcement like that, and if you go to their website, and usually they'll have a team page or pull them up on LinkedIn. And if they don't have a chief clinical officer or clinical co-founder, it doesn't look like they have a clinician in leadership, those are the types of companies I would recommend reaching out to. And especially if they're within your niche or specialization, maybe the company works with kids, for example, and you work with kids, then that's a great match. And so I think like in terms of being an influencer, having a large audience or following, that can help if you're looking for more of like a brand partnership, for example. But if you're, interested in being more of an advisor, I think having a specialization um, or niche for your clinical work can be as equally valuable.
Awesome. Thanks, Michael.
Oh, and then just there was a note here too. I think with a lot of these companies, this isn't just like clinical work as well. Like, you can be doing other things too. So that's another question is like how you're getting paid. Is it just clinical work? Like if you have to do documentation and other things, like are you also getting paid for that time or not? This is just a position that I have that I feel very strongly about, that making therapy affordable shouldn't mean paying therapists less. Um, I understand that therapy for a lot of people is inaccessible and it's expensive. And the way that we solve that problem is not by underpaying therapists. I think the way that we solve that problem is another conversation. Um, but take a screenshot of this. Like, I might get this tattooed on me. This is something that, like, this is a hill that I will die on. And for me, I think this is something I will continue to advocate for, that therapists should be paid their worth. We have about 10 minutes here. I want to end with a look at the future, and then also want to take some more questions as well. I hope this has been helpful. So in the next 3 to 5 years, like where do I see the future of mental health startups? I think we're going to see more and more regulation. Two examples here of companies that were investigated by the FTC and ultimately fined for the way that they were handling data. I think we're going to continue to see more of this. I also think there's going to be more consolidation. So in 2021, I mentioned almost $5 million or $5 billion, excuse me, was invested into mental health companies. That amount of funding has gone down over the last 3 to 4 years. So what that means is companies who have raised a bunch of money are no longer able to raise money. And so you're going to see companies consolidating through mergers and acquisitions. We saw that with Ginger and Headspace coming together. I think we're going to start to see more of that as well. Like smaller companies are going to be bought up by bigger companies. And then in terms of technology, there was a question here around like AI and where Uber and Lyft are going with self-driving cars. Like, is the future of therapy AI therapists where we're replacing therapists with AI? I don't think so, at least in the near future. Who knows? AI has advanced incredibly over the last 2 years to a point where it's now widely accessible. So we'll see, like in the next 3 to 5 years, what happens. Inherently, my belief is that therapy and the success of therapy is all about the therapist-client relationship, and that's not something that can be built through AI. With that said, I think there is opportunity for therapists and mental health startups to leverage AI to streamline workflows and save time. Right now, we're seeing a bunch of companies pop up who are offering AI powered documentation and progress notes where AI runs in the back of your session. And then at the end of the session, your note is automatically created. So it eliminates the need to write progress notes, which I know is something that therapists spend a lot of time on. That's pretty cool. Of course, we need to be smart, right? Going back to data privacy and security and all of that. And then another one that I've started to see more of as well, especially with EHRs and EAP platforms that are working with insurance companies, is value-based care and measurement-based care, right? Like showing outcomes from therapy as a way to negotiate, higher reimbursement rates. So I think as a field, we'll start to see more of that. I think we'll also start to see more virtual reality as well. I think virtual reality has been slower to develop and kind of go mainstream. But who knows in the next 3 to 5 years? I know Apple has their Vision Pro now, and I could see therapy being delivered virtually. I know that there's some companies who are working on some pretty cool technology, doing like VR therapy for kids that has had success. So I think there's definitely a lot of exciting innovation that's happening, and I would encourage, you to continue to have an open mind about the possibilities of innovation in technology, as long as it's responsible, right? So we talk about responsible and ethical innovation, always doing right by the client. Question around liability. This is a really good one. So when you agree to work with these companies, it's really important to understand who is liable. My understanding is that for most of these companies, they do not assume any liability. So you as the therapist are liable. They are just providing the technology and the platform for you to use as a therapist. And so that's very important, right? Like when we go back to looking out for your own license, is like you don't want to put your career or your license in jeopardy by working with one of these companies if you're maintaining liability and you're going to be impacted by decisions that they're making. So I think that's something to understand upfront before you get into any sort of relationship with one of these companies. Question here for therapists who have a product they want to create. So this is an interesting one. I think that therapists can be great founders. They have great ideas for developing technology. Where to go with this? I mean, I think there's a lot of like really great what are called no code tools now where you can build a website or you can build an app without having to know how to code. But I think like probably the way that I would approach it is if you don't want to try to do it yourself, is try to find someone in the tech industry to partner with. Um, I know that there are a ton of product people and software people and engineering people who are looking for a clinician to work with. I think therapists in tech is a great option. There's also like tech accelerators that you can join to learn more about the industry that help match founders. So I would just see who's out there and try to meet people who are like-minded. I think therapists in tech is a great place to start. Question about FTC investigations here. So my understanding is these companies were investigated, not the therapists who were using them.
Awesome. We got some good questions, and I love that we've answered them as we've gone. I know we still have a really good sized group of folks on this call, and now is your time because we've got about 4 minutes left. If you have any lingering questions, drop them in so Michael can answer them in real time. Aha, we got one. What other roles can therapists do besides CCO and therapist?
Yeah, great question. So besides obviously being like a chief clinical officer, chief medical officer, working as a therapist, I think your skills as a therapist can translate into so many different areas of a business. For example, at Herd, we have therapists on our team who are on our onboarding team. So every therapist who joins Herd has an onboarding meeting with a therapist who's on Herd, who's part of Herd, and so they walk them through the platform and help them to navigate the software, right? So they can relate to our customers really well. I know therapists who also work as content writers. So if you're interested in writing, it doesn't even need to be clinical content, but you also have that clinical expertise, right? So that's like blog writing, but also UX, and so UX being user experience writing. So like within the actual software and app itself, having a subject matter expert to write copy and content for the app is something that can be really valuable.
Nice. We just got a question from Debbie, and I'm not sure if you're equipped to answer this one, but we'll try. Can you speak more about the companies that set up clinicians with insurance and handle the filings? I'm told some have solid client data. Are the reimbursement rates, have sold client data? Are the reimbursement rates better through these companies?
So the insurance credentialing and billing companies, to my knowledge, have mostly stayed out of the bad PR, at least that I've heard. In terms of reimbursement rates, yes. So the way that these companies work is they essentially are building a large provider network, right? And so they go to the insurance company and say, hey, we have 10,000 therapists that we want to panel with Blue Cross. And because we are bringing all of these providers, we want to negotiate a higher reimbursement rate because we're going to guarantee X number of sessions per month or whatever. So they're able to negotiate higher rates, which then they are able to pass on to you. They do take a percentage, right, which is how they make money. Like they take just like essentially like a fee off the top. But my understanding is like even with that fee that they take, you're still able to receive a higher reimbursement rate than you would if you were to be paneled on your own. And then you also don't have to do any of the billing. So you save time there or money in paying for a biller.
Okay, great. And I know we are almost up on time. Let's see if we can just quickly get to these last two here. Is the expectation that therapists will be 1099 versus W-2 in these kinds of roles?
Great. And then just to finish the thought on that, there was a question, what are some of the leaders in billing insurance? So the major ones are Headway, Alma, Grow Therapy is a big one, Path, which is now Rula. I would say those are probably like the four major ones that if you're interested in taking insurance and building an insurance-based practice, they can help. Expectations of either. I think probably for the software platforms, those are going to continue to be 1099 type roles that flex up and down, right? There are companies who are building more like virtual group practices, like 2Chairs, for example. My understanding is they hire more W-2, and it's really kind of just like a large virtual practice versus thinking about like a software platform, more of that marketplace business we talked about.
All right, perfect. Well, we are at the top of the hour. Can we show them your contact info in case anyone wants to follow up with you?
Absolutely.
There
Yeah.
we
So
go.
if you're interested in learning more about Herd, if you're looking for help with your finances for your private practice, definitely check out Herd. I write a newsletter, Carrie mentioned, Therapy Marketer. Definitely check that out as well. And then you can find me on LinkedIn and Twitter. My DMs are open if you have questions about anything that we talked about today.
This is awesome. Michael, thank you so much for your time today. This was incredibly illuminating, and I know that it definitely gave me some new information and probably helped out a lot of folks on this call today. So thank you for taking the time. Again, just to remind people, I will be sending out a link to this recording later today. So if you missed anything or you want to revisit something that Michael shared, you will have access to this recording. With that, I hope everybody has a terrific day. And thank you again, Michael. Hope to have you back again sometime soon.
Thanks, Carrie.
Take care.
Bye.